V.A.C GranuFoam Bridge XG Dressing, Pressure Ulcer Application. The ActiVac, InfoVac, V.A.C ATS, and V.A.C Freedom Therapy systems are integrated wound management systems for use in acute, extended, and home care settings. They are indicated for patients with chronic, acute, traumatic, subacute, and dehisced wounds, partial thickness burns, ulcers such as diabetic, pressure or venous insufficiency, flaps, and grafts. This video is intended for clinicians. Prior to use of the V.A.C therapy system, consult and follow detailed safety and product information contained in the KCI V.A.C therapy clinical guidelines and the device or disposables specific labeling. Resources for safety information specific to the V.A.C therapy system are available at the end of this video. If you have any questions before initiating therapy, contact your local KCI representative. Call 1-800-275-4524 or go to www.kci1.com. V.A.C Spiral GranuFoam Dressing Application. After cleansing wound and protecting the peri-wound according to institutional or agency protocols, separate perforations as needed to fill the wound with appropriate amount of foam. Note: do not cut or tear foam over the wound, as this could result in foam particles falling into the wound. Place the dressing into the wound and cut or tear off excess dressing. Gently place foam into wound cavity, ensuring contact with all wound surfaces. V.A.C Drape Application. Trim the V.A.C drape with pre-cut hole to size. Note: allow a 3 to 5 centimeter border of intact skin. Peel and remove layer 1. Place the adhesive down with pre-cut center over foam. Remove layer 2 and pat drape to ensure an occlusive seal. Remove blue handling bar. Note: if not using the V.A.C drape with the pre-cut hole, use the extra non-perforated V.A.C drape. Pinch V.A.C drape and carefully cut an approximately 2.5 centimeter hole through the V.A.C drape. Note: do not cut a slit or an X, as drape could self-seal. V.A.C GranuFoam Bridge Application. Separate perforated V.A.C drape strips and set aside. Remove dressing release liner from the V.A.C GranuFoam bridge. Align the holes of V.A.C GranuFoam bridge and V.A.C drape. Route the V.A.C GranuFoam bridge to a location away from bony prominences. Secure V.A.C GranuFoam bridge with V.A.C drape strips. Remove layer 1 and place adhesive side down. Secure drape strip to skin and remove layer 2. Remove blue handling bar. Repeat application of V.A.C drape strips as necessary. Length adjustment of V.A.C GranuFoam bridge. Manage length adjustment with Z-fold technique. Therapy application. Connect Sensitrack pad tubing to canister tubing and open clamps. Record date and number of foam pieces in the wound on the tubing label and in the patient's record. Turn on power to V.A.C therapy unit and set to the physician-prescribed therapy settings to initiate therapy. Note: for vertical bridge placement on moderately to highly exudating wounds, the V.A.C GranuFoam Bridge XG dressing should not be used with V.A.C therapy pressure settings below -125 millimeters of mercury. V.A.C therapy is contraindicated for patients with malignancy in the wound, untreated osteomyelitis, non-enteric and unexplored fistulas, and necrotic tissue with eschar present. After debridement of necrotic tissue and complete removal of eschar, V.A.C therapy may be used. V.A.C therapy's foam dressings should not be placed directly in contact with exposed blood vessels, anastomotic sites, organs, or nerves. Instructions for use and safety information. As with any device, it is important to read and understand the detailed instructions for use and safety information, including information on bleeding, exposed vessels and organs, and infection, applicable to your V.A.C therapy unit and dressing application that can be found with the therapy unit, disposables carton, or in the V.A.C therapy clinical guidelines. www.KCI.flv. These sources provide information concerning the proper application of all V.A.C therapy dressings, including advanced applications and techniques. If you have product questions, please contact KCI at 1-800-275-4524, option number 5.